Well, it seems like vaccine mandates are back on the chopping block, and we've got a tug of war going where both sides are claiming to be right. On the one side, you have states like Idaho that ended mandates with a sweeping medical freedom law early this year, and Florida just announced their plans to wipe out old school vaccine mandates. Their message is clear: people deserve medical freedom, informed consent, and bodily autonomy. They acknowledge the vaccine injured and say where there's a risk, there must be a choice. On the other side, as a reaction to Florida's proposal, states like California, Oregon, and Washington joined forces in a West Coast alliance to protect and even strengthen mandates. Their slogans echo the COVID years: safe and effective, the science is settled, trust the experts, we need herd immunity to protect the vulnerable. But what they rarely, if ever, address are the vaccine injured, or what the other side is actually saying. So maybe the divide isn't really pro vax, anti vax. Maybe it's two ways of thinking. One says trust the authority, follow the rules, don't question, you're not really qualified to decide. The other says use your critical thinking skills, ask the questions, weigh the risks and benefits for yourself and your family, because you're the one who is going to end up living with any consequences. So here's my invitation to you. Set any politics and beliefs you may have aside and ask yourself, what matters most to me when choosing whether to vaccinate myself or family? Is it trust in authority or the freedom to ask questions and make informed choices? And here are some questions I personally find worth asking. Who exactly are the experts and why are they the authority? Have they scrutinized the raw trial data or only summaries? Who funded the trials? Who wrote and funded the studies? Were they ghostwritten, influenced by funding bias? Is it enough to speak to your doctor or pediatrician? What is the plan if I or my child is injured? How are injuries recognized, diagnosed, and treated? What is the process if a death occurs after a vaccine? What are all the risks and benefits of taking the vaccine versus getting the disease? What are my chances of getting the disease? Should the same rules apply to every vaccine, or should the risks and benefits be weighed disease by disease? Because what if the slogans don't hold up? What if an injury happens to you or your family or your child? For me, the choice is clear. People should have the freedom to decide with full honesty about risks and benefits. If your choice is to roll up your sleeve without questions, that's your right. But it's equally right for someone else to ask questions and decide differently. Because in the end, trust should never be mandated. It should be earned.